Can you talk us through doing a sub-Q injection,
Yes.
please?
Hello everyone, my name is Tori and I'm one of the nurse injectors here at SRQMedSpa. And so some of the medications that we administer and the vitamins that we administer, we can give subcutaneously, which means into a fat layer. And so there's really three places where we recommend injecting them. And the one that I'm going to show you today is around the belly button. So not within an inch of the belly button, but in the fat layer that kind of that goes over your abdomen that everyone has, no matter how skinny they are. And then the other two places, which I'm going to show you here on Shannon, are your thigh, the inner part of your thigh. You can inject there at home, and then the back of your arm. And those are all places that the American Diabetic Association would recommend for subcutaneous for like insulin, which is an easy way to think about it because insulin needles are what we tend to use. But today I'm going to show you in the abdomen. So, Miss Shannon, get you ready here. We always start with clean hands and gloves here in the office, but at home, if you were doing these, you do not need gloves, but you do need clean hands. Yeah. I'm just gonna pull this down a little here. And so when we do injections into the belly, into the subcutaneous layer, we split our belly into 4 sections and we call them quadrants. And so you have your right lower, your right upper, your left upper, and your left lower. And so with each injection, you want to change the injection site. So today I will do Shannon's left lower quadrant, okay? So we're gonna clean with alcohol. And then you wanna wait for that to dry because that's the part most people feel is the alcohol when you inject. That can be kind of painful. It should be dry and you just wanna pinch a little to make sure you get into the correct layer. And then so the needle that we use here, and sometimes we send home, is a little bit long. So you don't want that to go all the way through, and make sure you get it right into the subcutaneous layer. 90-degree angle. Can you see what I'm doing here? Mm-hmm. Big poke. Just about halfway in for the length of the needle. You want to hold it, and then inject. Then you just want to hold it there for a couple seconds to make sure the medication gets in, and pull out. There's no bleeding, there's no leaking. And that's a subcutaneous injection.
Thank you.
Isn't that bad?